Imagine waking up one morning feeling a little more tired than usual. You assume it's just stress or a bad night's sleep. But what if that exhaustion is actually your body's way of warning you about an impending heart attack? Heart disease remains the leading cause of death worldwide. Yet many of these deaths could be prevented if people knew how to spot the warning signs early. Would you be able to recognize the early signals your heart is sending you before it's too late? Many people mistake the warning signs of a heart attack for minor everyday issues such as fatigue, heartburn, stress or anxiety, mild chest discomfort, and shortness of breath. Sadly, ignoring these symptoms could be a fatal mistake. In this video, we're going to reveal the 6 major warning signs that can appear weeks, sometimes even a month, before a heart attack. And if you stay until the end, I'll also reveal one of the most overlooked symptoms, one that could literally save your life. Help spread this life-saving information. Before we dive in, do us a favor. Click the like button to help this video reach more people. This small action could help save lives. Subscribe to our channel for more expert health tips. Turn on notifications so you never miss crucial health updates. Share this video with a loved one. It could protect someone you care about. And stay tuned. At the end of this video, I'll tell you how to receive 2 free heart health gifts. Valuable resources to keep your heart strong and healthy. Now let's dive in. Sign number 6. Unusual fatigue that just won't go away. We all experience tiredness from time to time. Maybe you stayed up late, worked too much, or didn't get enough sleep. That's normal. But what if your fatigue isn't normal? Unusual, extreme, and persistent fatigue is often a warning sign that your heart is in trouble. What does this type of fatigue feel like? You feel constantly drained, even after sleeping for more than 8 hours. Tasks that were once easy, like climbing stairs or carrying groceries, suddenly feel exhausting. You feel heavy, sluggish, or weighed down all the time. As the day goes on, your exhaustion gets worse, not better. Why does this happen? Your heart is responsible for pumping oxygen-rich blood throughout your body. But when your heart isn't working efficiently, your body struggles to get enough oxygen to your muscles and organs. The result? Extreme, unexplained fatigue. This happens because your heart is working harder to pump blood through partially blocked arteries. Your muscles aren't getting the oxygen they need, making even small tasks feel exhausting. Your body is trying to compensate, redirecting energy away from other functions, leaving you feeling completely drained. Who is most at risk? Women are particularly vulnerable to this symptom. Studies show that many women report persistent fatigue up to a month before experiencing a heart attack. Women are also less likely than men to experience the classic chest pain associated with heart attacks. Instead, they may feel exhaustion, nausea, dizziness, or general discomfort. Don't brush this off. If you're feeling worn out for no clear reason, pay attention to your body. Could your fatigue be a heart attack warning? Here's what to ask yourself. Is this a different kind of tired than usual? If you always feel exhausted, even after a good night's sleep, this could be a red flag. Does this fatigue get worse with activity? If simple tasks like walking upstairs or doing housework leave you drained, your heart may not be pumping blood properly. Am I experiencing other symptoms too? Fatigue plus shortness of breath, dizziness, chest discomfort, or nausea could indicate heart trouble. Warning: this type of fatigue often goes unnoticed because people assume they're just overworked or not getting enough rest, but your body doesn't lie, it's trying to tell you something important. Sign number 5, shortness of breath, even at rest. Are you struggling to catch your breath, even when you're not exercising? If you suddenly find yourself breathless after light activities like climbing stairs or walking short distances, it could be an early sign of a heart attack. Feeling winded after simple activities, struggling to breathe while lying down, and waking up gasping for air. What's happening inside your body? When your heart can't pump blood effectively, fluid starts to build up in the lungs, making it harder to breathe. This sign can appear up to a year before a heart attack. This symptom is also linked to heart failure, where the heart struggles to meet the body's oxygen demands. If you're experiencing unexplained shortness of breath, it's time to see a doctor, immediately. Sign number 4, chest discomfort, the classic warning sign. Chest discomfort is one of the most well-known signs of a heart attack. But did you know that many people ignore it because they mistake it for indigestion? Tightness, pressure, or pain in the chest. Pain that comes and goes over several minutes. Discomfort that worsens with exertion or emotional stress. Why does this happen? Your heart needs oxygen-rich blood to function properly. When plaque blocks the arteries, blood flow is restricted, causing chest discomfort or pain. Almost half of all heart attack victims report experiencing some form of chest discomfort beforehand. Don't ignore even mild chest pain. This sign can appear weeks before a major heart event. Quick tip. If your chest discomfort intensifies with exertion but eases when you rest, this could indicate angina, a warning sign of coronary artery disease. Sign number 3. Frequent indigestion or stomach pain. What if that constant indigestion isn't just about food? Many people mistake the early signs of a heart attack for acid reflux, nausea, or stomach pain. Feeling bloated or full after eating very little, frequent stomach discomfort that doesn't go away, or a burning sensation that feels like heartburn are all signs to watch out for. Why does this happen? When blood flow to the digestive system is reduced, it can cause discomfort in the abdomen, mimicking the feeling of indigestion. Important. If your indigestion doesn't improve with over-the-counter medications, it could be a sign of an impending heart attack. Don't wait. If you have unexplained indigestion that lasts for weeks, get checked out. Sign number 2. Sleep disturbances and insomnia. Are you struggling to fall asleep or waking up frequently at night? Sleep disorders, especially insomnia, have been linked to an increased risk of heart attack. Trouble falling asleep or staying asleep, waking up suddenly gasping for air and feeling exhausted even after a full night's sleep are symptoms to be aware of. What's the connection between sleep and heart disease? Poor sleep quality increases inflammation in the body. Lack of sleep can raise blood pressure and stress levels. Sleep apnea, a condition where breathing repeatedly stops during sleep, doubles the risk of a heart attack. People with insomnia have a 27% higher risk of heart disease. If you're experiencing persistent sleep disturbances, it might not just be stress, it could be your heart sending you an early warning sign. Sign number 1, cold sweats and unexplained excessive sweating. Sudden, unexplained sweating could be a serious warning sign. Cold sweats that happen at rest, sudden, intense sweating with no reason, and drenched sheets in the middle of the night are all red flags. What causes this? Your body activates the autonomic nervous system when the heart isn't getting enough oxygen, triggering sweating to regulate body temperature. 40% of heart attack survivors recall experiencing unusual sweating as a symptom before their attack. If you're suddenly sweating excessively, even when you're not exercising, take it seriously. This could be a warning sign of an impending heart attack. Final thoughts. Don't ignore these life-saving signs. Heart attacks don't always strike suddenly. They often give warning signs weeks in advance. Here's what you need to do. Listen to your body. If something feels off, don't ignore it. Get checked early. Early detection can save your life. Adopt heart-healthy habits. Exercise, eat well, and manage stress. Your health is in your hands. Don't wait for symptoms to get worse. If this video helped you, hit the like button and share it with someone who needs this information. Subscribe for more life-saving health tips. Drop a comment below. Have you or someone you know experienced any of these symptoms? Let's talk. Watch our next video on 10 foods that clean your arteries naturally.